you're more than welcome.
Well, let's start with introductions. That's the first item on the agenda. So why don't you go first, being the sector lead?
Yeah, thank you, Katie. Joey Leitner. I study physical activity and public health systems. I used to work at a public health department. I've been in public health a long time, and love public health and love the ability to use public health to improve physical activity in Kansas City. Nancy, you want to go next? Sure. Yeah, you can type. Brian?
Sure. I'm Brian with Children's Mercy. I work in the school-based health initiatives sector here in the area.
Thanks for being here, Brian. Katie, do you want to, you didn't introduce yourself yet. Everybody knows you.
Yeah, probably. If you get any correspondence from the KC Healthy Lifestyles Collaborative, it's probably from me. But I am Katie Amy, and I work for the KC Healthy Lifestyles Collaborative. I help support some of our different initiatives, one being the KCPA plan, and one of them with the sectors within the KCPA plan is the public health sector. So thanks everyone for being here. I'm going to go ahead and pass it on to Sandra.
Hi, I'm Sandy. I am a dietitian at the Johnson County WIC offices. I've been here for a very long time, 20 years. I wasn't here. Do we have any other questions that I need to answer?
Nope, just introduce yourself and then popcorn it off.
Okay. I will pass it off to Nancy.
I think Nancy's mic's a little weird. So
I can go ahead and read Nancy's response though. So she went ahead and posted in the chat. So Nancy is Dr. Leitner's GRA, and she is wrapping up her MPH at KU Med. And she does a lot for Joey. I'll pass it on to Simone.
Hello, I'm Simone Taylor. I am the Regional Women's Health Analyst for HHS in the Office of the Assistant Secretary for Health. I'm a nurse, and I worked with Joy way back when at the Public Health Department. Oh, I will pass it to I'm gonna just go forward and say Bolupe, and you can tell me how terribly wrong I said your name.
You're fine. That's fine. I'm Bolupe Ogunyoye. I am a community health field specialist with MU Extension. Yeah, that's about it. I will pass it on to Leah.
Hi, yeah, I'm Leah. I am the community program manager here at Clay County Public Health Center. I'm a dietitian by background, and I used to work at Children's Mercy for a long time before I moved over to Clay County. So I've got love in my heart for Children's Mercy for a lot of reasons. And then I will go, I guess, I don't know, DC, JCDHE. I don't know who that is.
Hi, everyone. I'm DC Okanta. I work for Johnson County Department of Health and Environment in the epidemiology department. I'm a disease investigator. Let's see, what else? I like full moons. I don't know. That's pretty much it. Love physical activity. I'm glad to be on the group. Thanks, y'all. Oh, hey, Nancy.
Well, thank you everyone for being here today. So Joey, did you want me, you said, to go through the agenda?
yes, but I think we're missing Dan. Is that right?
Oh, sorry, my bad. Yep.
No problem. Hey, nice to see everybody. I've been delinquent for a while. I am Dan Kane. I'm with UCare. We're one of the managed care companies. in the market here. We're based in Minnesota, but we're working with the Kansas Medicaid RFP. And I'm always interested in exercise as medicine and Dr. Shook's initiatives, and glad to be here. And let's see, I need to pass it. Okay, how do I pass it?
I think
Oh.
that's everybody. Bonnie just jumped on, but we can move forward and she can introduce herself in a bit.
Okay, so the next item was just for those who are new to review the strategies. Do you want to do that, Joey?
Will you share the infographic? So, guys, oh, do you have it up? Sorry, I'm putting you on the spot, Katie.
I don't, but go ahead and talk while I find
Okay.
it.
So one of the things that I always find frustrating is that, like, you know, there's so many strategies and tactics of all these different sectors and stuff. And so Katie was a rock star as always, and put together just a quick like infographic of the 6 strategies in this sector so that we can just like go to it really quickly and have it available. So Katie's going to share it when she finds it. It's in a file somewhere. And it's just really easy to kind of break it down into, you know, what we're talking about. You want to share your screen, Katie?
Yeah, I'm working on it. I had to expand my Zoom so I could find the share button. So the one I actually just posted, and this one, it's actually the wrong one. It's got a blue background, but still the same thing. So this one's
Yeah.
just cleaner.
And
But
so
yeah.
what Katie, yeah, go ahead, Katie, talk through it.
No, you're great. So so strategy 35, to sum it up, it's disseminating. So disseminating tools and resources important to promoting physical activity. And then we've got strategy 36, which is based on surveillance, expanding monitoring policy and environmental determinants of physical activity and the levels of PA in communities, and monitor the implementation of public health approaches to promoting PA or physical activity lifestyles. And then strategy 37 focuses on advocacy. So engage in policy development and advocacy to elevate the priority of physical activity in public health practice, policy, and research. And then 38 is partnerships, create, maintain, and leverage cross-sectoral partnerships and coalitions that implement evidence-based strategies to promote PA. And then 39 is based on equity, so invest equitably in physical activity, commensurate with its impact on disease prevention and health promotion. And then strategy 40 focuses on workforce, which we are going to talk about next. So develop and maintain a workforce with competence and expertise in physical activity and or health, and that has ethnic, cultural, and gender diversity. So.
And so when we're, go ahead, sorry.
No, you go ahead.
So when we're thinking about how we want to impact public health, physical activity stuff, how we want to work in this group, I think this makes it a lot clearer, right? Like disseminate, surveillance, advocacy, partnerships, equity, workforce. Like these are kind of our like 6 buckets or so that that we've kind of tried to focus in. Katie, I will just mention that partnerships is has a little error in it. Spelled wrong.
Well,
yeah.
Thanks. Oh, it is. See, this is the wrong one. That's why.
It's draft form, but all good stuff. And I think it just breaks it down so that it's less wordy and more like, this is what the intent of this thing is, right? Any questions on that stuff? Cool. Katie, that was in the newsletter, right?
No, it wasn't, but I can include it in the next one.
Yeah, so Katie will include it in the next newsletter. And if you want to, can you add it as a attachment so that people can use it?
Yes.
Cool. Super. So that's coming your guys' way. So next thing on the agenda, Katie.
Is kind of following up with what we discussed last week. So we were talking about implementation project ideas that we could work on together as a group. So we were looking at strategy 40 workforce and discussing how ideas for ways we can start promoting physical activity within health professional workforces, specifically aimed at health departments. So how do we get health department workers to engage in more physical activity? And then the other one we were looking at was we were going to compare local Kansas City area chips and chaws to look for overlapping variables or focus areas.
And I think the chip chaw kind of question is really more in partnerships than in workforce. I think that's where, in my mind at least, that's kind of where it goes. But that's just me. So as a group, let's decide real quick. Do we want to talk? Which one do we want to talk about first? I think we have 45 minutes. We can get to both of them. Katie and Nancy have put together. Why don't we just start with the chip chaw stuff? I guess it's all chip, really less chaw. But why don't we talk about that? Katie, Nancy, do you guys have that document that you started and you want to review it?
Sure. And then when I get a second, I'll drop the infographic in the chat.
Cool.
Okay. Nancy, should we go over this tab first or just discuss our easier version of
Katie, why don't you talk about what you did and then the outcomes?
okay, so this would be easier. So we went through each chip. Mind you, some of these are expired. And we started with the priority areas, and so I don't know if I'm going to be explaining this great. So anyway, within those priorities, we read through the goals and any of the strategies to focus on those goals, and if they mentioned or related back to the kind of variables we were looking for. So it needed to relate to physical activity, nutrition, built environment, specifically focusing on like green spaces. We looked for things like obesity, and then also this one's one. So social connectedness. I don't know if I'm missing any. So transportation, active transportation. Okay. So these were kind of the terms we were looking for and if it related back. So what we found was that there's not a lot. And Nancy, please, oh, your mic's off. I forgot. I was going to ask her to jump in if I'm missing anything. So if you'll note that not all of these areas are filled out. So anything that is filled out is because it relates back to what we were looking for. And this is just more like a busy document. It's easier to look at this area. So if you notice an X, this is mentioned and it relates back to the area's chip. Does that make sense to everybody? Okay, great. So this is pretty much what we found. So Jackson County was the only county with a chip that had anything focused on physical activity. Sorry, Eastern Jackson County. And so the health departments that Jackson's also expired, Nancy said. Yeah, it's really expired by a couple years. And so Plate and Clay and then Eastern Jackson are the only areas that have anything related to nutrition or access to healthy food within their chip. Johnson County, Eastern Jackson, and then the KC-Mo area chip discussed priorities related to built environment or strategies. And then Plate and Clay discuss transportation or active transportation more specifically. And then Eastern Jackson County is the only one that discusses anything related to chronic conditions, so heart disease, diabetes. And then this one I believe is Wyandotte County, that's Johnson County, and this is the KC-Mo area are the only chips that discuss anything related to community or social connectedness in general. So
this is interesting. Will you go back? Can you put this all on one page, Katie? Yeah, that's good. So this is, I think, is really focused around physical activity, right? And I think that's interesting. What one before, I mean, I can diagnose all these, like talk through all this sciencey and stuff. Let's open it up to the group. What do you guys, is this surprising to anybody? Does anybody have any like feedback on this?
So I want to mention one more thing. Again, we are focused on like healthy lifestyles and health behaviors, specifically like mostly within physical activity and nutrition. So one of the things we discussed last time was looking at mental health. The reason we didn't is because, or included on this, I just before anybody asks why, is because a lot of the priority areas that dealt with mental health, we're talking about substance use, oh, I forgot what else, and suicide prevention. So it didn't really relate back to what we were focusing on as a group, just before anybody asks.
Yeah, I just have a comment. I don't know if it plays in here, but the way that Clay County looks at this, so we have a contract, a maternal and child health contract and that's where we focus, like, it's not in our CHIP or CHA or part of the Northland Health Alliance, but we do focus on physical activity and obesity in children, in that. So it's a little bit separate and it probably should be a part of it, but it's not, but that's how we're addressing it.
Yeah, and I mean, we've noticed that a lot is that like when we look at just chips and chaws, right? Like the health, there's, you know, the chaw chip process is really like the external health department process, whereas the strategies or what is it called? The strategic plan, the strategic plan for a health department is really that internal process. We should probably look at both, but most of the time those strategic plans are not published. So we can get them from FAB, but like, you know, that's a challenge. And so definitely an issue for sure. What else? What other kind of like thoughts do we have? I mean, in my mind, and correct me if I'm wrong here, but you know, most chips are moving towards like understanding root causes, social determinants, you know, focusing on these other things, right? And so while it may not specifically mention physical activity, oftentimes, you know, physical activity, you know, can or should potentially be in that like process of what's going on. There's a lot of like policy systems, environmental change in current chips as they're kind of written now. That all being said, I think it's really interesting that every chip has something associated with healthy lifestyles or like social connectedness, community design, like those kind of things, right? That I think is really encouraging. Is that surprising to anybody? So also, I think this really shows how like health departments or the CHIP process is thinking about physical activity or healthy lifestyles in a context of their chips, right? So instead of thinking about like, hey, everybody should be have a gym membership and increase physical activity, which is a really hard behavior to change, right? Which we know that now. Instead of focusing on that, we're going to focus on the built environment, or we're going to focus on community design and social connectedness as a way to impact physical activity, right? Yeah. I mean, what do you guys think about that? The folks who have participated in like a CHIP process, when we're in meetings with community members and stakeholders and those kind of things, right? People understand that physical activity is a problem. And the mechanism of change is often these other things, right? And that's what they're going to focus on in order to get people to be active. Does that make sense to everybody? Yeah. I would be really interested to see, like, I mean, Nancy, we've done this paper with implementation strategies. Really, like, what our health departments, how does this translate downstream? Like, what does it mean to like focus on the built environment or green space? What does it mean to focus on community or social connectedness, right? Like, what is that in reality? Is that partnerships? Is it advocating for complete streets? Like, what, you know, what is that in reality? I think would be a really interesting thing. I don't want to take up all the oxygen in the room. So if anybody else wants to talk through any of this.
Hey, just a quick question. When you're saying chips, are you talking about the state CHIPS, like,
No, you're
okay,
thinking of
what-
child insurance programs, CHIP.
yeah,
No.
tell me what,
In-
yeah, I'm sorry, I was
in
gonna
pub-
type this.
Yeah, Dan, in public health, every accredited health department is required to do a community health assessment and planning process every 5 years. Nonprofit hospital systems are also required to do the same process every 3 years. And what we have found in Kansas City is that, thank you, Nancy. Yeah, we didn't include the state health department chip, or because honestly, the state of Missouri rarely cares about Kansas City metropolitan area, right? But yeah, Dan, totally separate things. The child health insurance programs, that's not at all what we're talking about. You're muted, buddy. Sorry.
Tell me your acronym again. You said it was
Yeah,
community
community health improvement plans.
improvement. Okay, improvement plans. Cool.
Yeah.
Okay, thank
CHAWS, Dan, CHAWS are community health assessments.
you. Okay,
Yeah. So when we talk about a CHA chip process, that's like the assessment planning process that goes hand in hand, and health departments are required to do it every 5 years.
who does that go up to? Is that reported to the state?
It's reported to FAB, the Public Health Accreditation Board.
Oh, okay. It's for your accreditation, and then you can, okay.
Yeah.
Annual accreditation. Okay, thank you.
It's every 5 years. So, Katie, we all again share your screen. I'm sorry, and go to the other tab. I think, guys, the other tab might be really important too. And because when I'm thinking about all this stuff, I'm thinking that, like, how do we get health departments on board to like start, maybe if not like, working together on, the assessment planning process, at least thinking about like what everybody else is doing and how they can share, resources and disseminate tools. And like, if Kansas City is focused on violence and Wyandott's focused on violence, why aren't we focused on violence together? So we're all the same city, and these arbitrary lines that we draw are arbitrary, right? So Katie, I don't know if anybody, can you zoom in just a little bit on really the first 3 columns? And if anybody from the agencies want to talk through this, feel free. Katie, will you just review this real quick? Like, I'm just thinking through, like, what are the commonalities beyond physical activity that these chips have?
Oh, so you mean like looking within to the priority areas? Because not all of the goals are labeled.
Yeah, that's fine. The goals are fine, but I think, yeah, what are the priority areas? And like, what are, is there a way we can identify is everybody focused on this, that we can get people to rally around?
Yeah, so Johnson County and Jackson County both discuss some aspect of mental health. And then I'm gonna go ahead and start saying Northern Health Alliance to make it easier. We know that that's Clay and Platte County. Okay. So maybe, so just so we know how we did this, Nancy took the Missouri counties and I did Kansas counties. So I need to make myself familiar with the Kansas information really quick. And to do that, I am going to zoom out for a second. Why is that? That's why. So mental and behavioral. So Cass County has mental and behavioral, so that's 3 counties. Northern Health Alliance does address behavioral health. So I feel like that is a huge one, but I feel like we already knew that as well. Mental health being a huge priority lately. Safe and affordable housing. So Johnson County and the KC metro area both look at affordable housing.
I think there's so many. I mean, like, we can put this together in a way that like is easy to digest,
Yeah.
right? Katie, zoom in on this. Nobody can see.
Yeah,
It's
sorry.
too far out,
I
and
think
you can like collapse this column F or E or whatever so that it's like doesn't make this table terrible. So we can put this together, send this out so that everybody can see it. But I think there's so many commonalities in all these chips. So like, Katie, if you just want to, yeah, if you can make it so that like we could see the list of them, either just delete that column and resize it or something. There you go. So I see like substance use as a thing, right? I mean, that like if that's in either substance use or misuse, behavioral mental health, it could be in that. There's access to care in more than a few of these, right? Access to healthcare, access to affordable healthcare, access to healthcare, right? Access is an issue. It's like jobs. I mean, jobs is social determinant of health, right? But jobs are in Wyandotte. I think it's in case. Is it in KCMO? I'm sorry. I gotta like think through. Not really.
No.
Yeah. Housing is definitely in here, right? I think we're all kind of guys, I think we're all focused on the same stuff generally. What do you guys think about that? I think a lot of it is very like public health 3.0, right? Like focusing on the social determinants, thinking through like, you know, the root causes, which is great, right? And we should do more of that. I'm really interested in like what that means in reality, right? You know, like is that just partnership building and like nothing gets translated downstream? You know what I'm saying? This like issue that we have in public health of like we can get people in a room and talking and then like where's the change, you know? Other thoughts?
I always think of it as being kind of funding source driven. You know, you have to get reimbursed for your staff to coordinate and do this work. And so I think everything kind of always starts there. Where is the funding? Where is the structure to do the work? Then the second thing now I think is even before social determinants of health is that the drivers is what I'm referring to is the patient-centered health. And that's the patient directing their health. They're the ones that are coming in for these issues. And then number 3 would be the partnerships, the relationships for referral. So that's your relationships, partnerships with the other health providers that drive referral and services into your public health entities. One you mentioned, and I know they call them in Kansas, it's community mental health centers. And I think it's probably called the same thing in Missouri. But you know, there's 22 of those. Those are the points of access for public health to mental health to access kind of through that, through those programs. And those are the mental health, the SUDS that you mentioned, that is kind of recurring here in your notes for, you know, the whole person care. And again, that goes back to kind of number 3, the relationships. And then finally, outcomes. You have to track the performance of what you're doing. Is it making an impact? Are we bringing value to the equation through those 3 or 4 other elements? So that's kind of the order that I see it happening as far as designing something effective to kind of drive growth and effectiveness.
So to Dan's point of like, what do we do with this information, right? That's, I think the question is like, I'm really looking at like Sandy, Leah, you know, Simone, other folks in the room. Like when we think of health departments, right? We all kind of have we have our thing, you know, and it's really like this, and we have our people that we work with and our places and like, you know, I guess, what do we do with this? Our health department's ready to, Leah, go ahead. You're muted.
Yeah, I was just gonna add something. You know, we have been working on trying to do physical activity, like I said, for this maternal child health contract for a while. And even since COVID, we can't get in. All the partners that we would work with, a lot of them are just stretched thin. So anything outside of what they have to do is not something they're able to do right now without us supporting almost, like we're bringing everything to them. Like we've heard multiple times from school partners, like, hey, if you can just come and do it, then we're fine. But we can't do anything. We have no capacity to help. Even a lot of the healthcare, just all the realms we've kind of approached that at so far in the last couple of years, that's been a really big barrier.
Yeah, I completely feel that, right? Because we work in schools and in the community and stuff, and like unless you're paying an outside group to like come in and do it, there's just no capacity there. And I think capacity goes on hand in hand with like people are stressed out. There's a lot of stuff going on. We're all trying to make up for lost time during COVID, and then there's training, right? And training is a major issue for physical activity stuff because it doesn't have to be hard, right? It's just.
Right. We had a school district recently tell us like, hey, we would love to, but we can't. Even our PE teachers can't take on more. Like they just can't do it.
So what's the solve to that, Leah? Is it like, do we need to focus on like training more folks in physical activity before we can do really anything else?
That's what we're going to try and do. We're going to try and use a partnership to train individuals in the community that are passionate about it, that are already in the community, and they're invested in it, and they have other activities where that can be part of it. But we'll see. I mean, I don't know if it's going to go anywhere, but that's what we're trying next, is to bring all of that to them and just say, hey, this is free. You can do this. But we're not there yet. We're still working that out.
Leah, one of the programs that I wanted to do for a long time, and this gets to Dan's point. Dan really speaks from a healthcare, mindset, or like that language of healthcare. But in the community where like a lot of us work, right? How do we get this stuff done? And so one of the programs that I wanted to do for a couple of years, and I just honestly haven't found a funding source to make it happen, is like having a group of trained community health workers that physicians, nurse practitioners can refer to. So if somebody comes in pre-diabetic, diabetic, hypertensive, whatever, they refer to a group of community health workers that are like from the community, that know the struggles that people are facing, that know the resources, right? And essentially work with them in like a social worker mentality around physical activity. We train them enough to promote physical activity, but like, guys, walking, I mean, like rec sports, going to the gym, going to classes, like there's so many things people can do that are not hard, right? That we don't need, we're not training PTs here, physical therapists. We're training like folks to like encourage physical activity. And Leah, if they have their CHES certification, they can be reimbursed through insurance and Medicaid. So that's totally, if we wanted to work on something like that, I would be totally interested in it. Or we could do it here. I mean, that's part of this group.
So it's funny you say that. We just hired a CHES this last year for our community health educator, and we are looking to add in community health workers in the next year or two. And so one of the barriers is funding for that. So I think from our standpoint, that would definitely be a beneficial avenue to pursue in the next year.
There's this great clinic system in Dallas. My friend Kevin is like managing it now. It's the Baylor Smith White clinic system that has like on-site gyms and like rec facilities that, essentially like the physician does the thing and then they walk across the street to the rec facility where they do like intakes with community health workers. They get into like classes right away. They do that kind of stuff. It's a cool model.
Yeah, and I'll bet they're measuring how it's doing too. They track that. Wearables are a big thing now. I mean, that's really will be a big driver to the reimbursement. Is when you see the effects, you have the data. You benchmark it and you have data. And you mentioned the community health workers. Their role is going to be expanded. There's been some meetings at KHI, that Kansas Health Institute. I got one on right now about aging. But they are going to expand, for instance, talking about growing programs. They're going to take the EMTs that are in these ambulances and have them get be a certified EMT where they go out and do kind of preventative services. And that's what we're talking about. This is preventative. These are preventative services that have a big impact, you know, diet and mental health. And those are the kind of the trinity. But they are expanding this CEMT program. They do it in 17 states, and they're expanding it. And Kansas is now looking at it. The legislature, they're looking at ways to expand those roles. So, like the community health workers, you know, some of their function will, you know, it will expand. It will expand into some of these areas that you're talking about. I mean, they're already right there. They're kind of the you mentioned they're down in the community. They know the people they're working with in these, and I'm talking about rural, you know, there's a lot of rural areas where they're going to be a key factor in, you know, coordinating care.
Yeah, totally. I just want to mention Belupe's comment. Yeah, we focus on physical activity because this is the Kansas City Physical Activity Plan, and we have these strategies to increase physical activity. That doesn't mean that we can't do other stuff too, right? So like my goal, I mean, I think a lot of our goals is to like increase physical activity for folks, right? We like physical activity. We think that like it has, you know, what's the saying? If physical activity were a pill, it would be the most prescribed medication ever, because like it's so good for you in so many different ways, right? And that's what we try to do. The mechanism change, that's the hard thing, right? Because people have to, you know, we all know this, have to live in safe environments and access and time and money and blah blah blah. Okay, so I guess next steps on this stuff.
Can I jump in really quick? I don't know if we mentioned this at the beginning of why we are doing this. So, we discussed at our last couple meetings how if there were an opportunity or if it was a good idea to create a like PC metro-wide area chip, and how would that look like and how would we do it? That's why we're looking at these overlapping areas for, yeah, separate chips.
Can I just throw something out there? Unless anybody else wants to add anything before we do. Okay. I think the September quarterly meeting, we could potentially propose to the leadership of the Kansas City Physical Activity Plan that, because that's going to be in person, right, Katie? What if we used that quarterly meeting in person with like, is breakfast provided? Yes, cool. To invite public health folks and talk about like public health physical activity things, right? Getting everybody, just getting everybody in a room, sharing you know, everybody's chips with each other, talking about all of the stuff we have in common. And you know, if we can focus on physical activity, that's cool. But if the conversation doesn't go that way, that's okay too, right? I'm happy to share some of the stuff that we've learned about. We've done like some national samples of chips and physical activity. We've done some other stuff about like, you know, how much chips cost. That thing should be done at some point in the near future. So there's, you know, there's a lot of stuff that we can share and like start a conversation around, and maybe using the next, you know, few months here to really put down, you know, what kind of information do we want to disseminate to folks? You know, do we want to collect like Leah mentioned, you know, there's all these things that are not in chips that are part of the health department's objectives that they're trying to do, you know, getting that somewhere, and like people talking about those kind of things, sharing resources. What does the group think about that?
Yeah, it's about those partnerships, isn't it? Yeah, that's what we're talking about, is integrating with, you know, coordination of care and being part of that link.
We
Sounds
could, yeah, I mean, we could, Katie, and I could be just like stepping on a million people's toes because I haven't ran this by anyone. Just so everybody knows, I just throw out ideas and like stuff happens. I think it'll probably be fine, but who knows? You know, I could just be like, somebody's going to yell at me for coming up with ideas and talking about it in public.
But I
Simone?
think it's, Joey, I think it's a good idea no matter what, because if we are doing all this kind of work in the background, right, around physical activity, it makes sense to bring those folks together that we're talking about all the time to the table and say, hey, this is happening, and get some conversations going so that they can tell us ways we might be able to support them and vice versa. And we're not just working in a silo.
Well, and I think giving every health department the opportunity to talk about what they're doing in terms of physical activity could be a really good thing, right? If we get,
And it'd be good for us to know as well, because there may
Yeah.
be things that we're not aware of.
Yeah. And so if we could all like have, breakfast and like give a brief overview, talk about some of the stuff that we've done, and then like give every, representative from every health department 5 or so minutes to talk about what they're doing in terms of physical activity.
I like it.
Okay.
Yeah, that's key to have their voice more, them tell us than we need to listen to them, because they're a treasure trove of reality for us.
So Leah, Sandy, what do you guys think? Think health departments would be on board?
I know ours would.
I think so.
Cool. Okay, so Katie, who do I have to bribe to make this happen?
No one. I need to talk to Shelly because she plans our quarterly meetings. We already had it written tentatively for you to be a presenter, so the only thing that would change would be inviting other people. Yeah, I'll work on it. I'll let you know.
Cool, awesome. So on that, we should probably get some like recruitment materials, thinking about getting it on people's calendars because it's a date, right? And it's in August, right? August,
September.
Okay. So that's something that like is, important. Contacting those folks, allowing them to like know that they could have time to talk about what they're doing, all that stuff, getting an agenda together, blah, blah, blah.
Mhm. Yeah.
Cool.
Is there an association, because we're focused, I'm thinking whole states and areas, kind of, healthcare delivery and with the hospitals and how everything flows. Is there a regional public health, like the Kansas City Metropolitan public, like I know there's the Kansas healthcare, Kansas Health Department, the associations at the county level, but it's all the counties. So we're talking about rural and everywhere. Do you all have a organization that you focus on for the metro area for delivery and things like that?
Yeah, I mean, Leah, Sandy, you guys can talk about this, but I can also jump in if you want.
That might be a good starting point, when you're talking about bringing them in through
Yeah.
something like that.
We have something in the Northland called the Northland Healthcare Access. So we don't really work, well, to my knowledge, and I may not be informed of this. I'm relatively new, but like we do a lot of work with the Northland Healthcare Access, or Healthland Alliance. So we have Healthcare Access as another group. And so it's the 2 counties in the Northland of Kansas City, like north of the river, right? That's kind of how Kansas City divides a lot of times. And so we do work together, just to pool resources and have, working together. So if there was something that we could do metro-wide, I'm sure that would be something to be interested in, but to my knowledge, we're not doing anything like that.
Okay, I can do some research and see what's out there. I think, right, the first thing that popped into my head was Kansas Healthcare Coalition, Troy Raw. They work with the hospitals and public. They work across the whole spectrum of
Yeah, Dan, there's really not. I mean, there's no, COVID was the first time that I think the directors really came together on a regular basis. And I think since COVID has not ended, but, passed, I think all of that has fallen apart. There are interesting groups like the Kansas City Data Collaborative, where it's like the epidemiologists who get together, statisticians, those kind of folks. But, if we're talking about like a cohesive public health system for the metropolitan area, I think that is a wish that a lot of us had in public health. Just there's nothing though. We all are doing our thing, and there's no cohesive structure at all.
Yeah, I was just thinking if you had that already in that entity, that would be the go-to for
But that's
accessing accessing, but it doesn't exist maybe.
I think that's the problem. Exactly. I will say though, to your point, Dan, of nonprofit hospital systems are also required to do a community health needs assessment, is what they call it, and an implementation strategies plan to keep their 501 status. Right. I do think that if we could get those people too at that meeting, Katie, that would be super useful. Nancy has a list of some folks that we have contacted as part of a study. I think that would be really valuable because they should also like they do assessment and planning. They should be there and they have money to like back it up with, which is nice.
I mean, I can get Children's Mercy for sure, obviously, but
Yeah. Yeah, Nancy has a list of the other ones. There's a couple that we could like invite Nikki Donowa from University Health, and the St. Luke's folks. What's the group down south in Johnson County? What's the nonprofit hospital system in Johnson County?
Is it Olathe Health System?
I think Allegiant. What is it, Nancy? Advent.
Advent. Yeah.
Advent. Yeah. So, obviously getting to the person who does the assessment and planning, the implementation strategies plan is really hard, but yeah. Okay, Katie, so update us on that next month. I do want to get us moving because we have a few other things on the agenda. Katie did mention in this conversation while we were having it, Leah, I think this really just speaks to what we're talking about. We are funded to put together we want to do like a national physical activity curriculum is what we call it. And so it's essentially like an online, lecture-based, like the bare basics of what you need to know in terms of physical activity, epidemiology, like physical activity guidelines. These are the levels of influence. Here's a couple models that seem to help, some motivational interviewing stuff, and this is really focused. It's not focused on a lot of the policy systems environmental stuff that we do, right? But it's really focused on like, what do community health workers, what do physicians, nurses, and there's like different modules for physicians and nurses and community health workers need to know in order to do individual behavior change with folks. So it's coming together. If you would like to help with it, we'd love some help. But
so Joey, I sent that message to you privately.
I
So
know.
everyone knows. Okay. I was like, I didn't mention it, but Joey's creating a physical activity curriculum. Yeah. So just so you know what he's actually talking about. And actually it's part of
What was that, Leah? I'm sorry.
Sorry, I'm so sorry, Katie. Yeah, totally on board. Work with many physicians that don't know how to have that conversation. So on all levels, be great.
Yeah, so we modeled it after the national. I also do some HIV work, guys, and we modeled it after the kind of the national physical activity or national HIV curriculum that UW did as part of the HRSA funded project. And so like this is very the physician like focused, right? But kind of like if you think through like, here's the kind of the different modules, here's kind of the bare bones of like physical activity stuff. That's what we're getting at. And so we're developing the curriculum now. We have kind of the modules set out and like stuff's moving forward. Stephanie Ellison from UMKC is leading the physician stuff. I work in the School of Nursing and Health Studies. So we have a nurse, Tracy Corey, leading the nursing stuff. We're doing community health worker stuff because, that's kind of our students often go into those careers. But really like dumbing it down and like being like, this is not hard, right? Here's kind of the basic stuff. And then, later if we want to do more intense stuff or, link to like the physical activity program that South Carolina does or other things, we can do that later. But it's it's needed, right? There's nothing out there that like is a succinct, clear, easy to digest program for folks getting into physical activity.
Hey, Joel, I know we're running close on time. The healthcare reimbursement group, they were developing the exactly what you're talking about, the elements that going to make up the assessment, and they were trying to get reimbursement, remember, for non-physician services where they could provide it in the community, like the community health workers and those those providers, and then it would have to be reviewed by like a PA, nurse practitioner, or someone that's coordinating the care, overseeing. They'd have to review the chart and the assessments and things like that for the physical health piece. I don't know where they're at on that. Is that still being worked on?
It's
I
still
I used
being
to be on that
pursued.
committee and I kind of bailed on it. But
Are
I'm
you
back.
talking about, sorry, Dan, are you talking about our healthcare subgroups, our billing and
Yeah, the
reimbursement group? Okay,
subgroups, right? Yeah,
I support those too. So we also have a curriculum subgroup. But yeah, it's kind of on hold. There's David White, who's leading that. He's kind of facing some
yeah, David.
roadblocks. Yeah, dealing with like just the codes, the necessary codes they need to use in general.
Right,
So
to fund it, yeah, to make it all work, so you get paid for doing it. Because if you don't get paid for doing it, it's hard to do. That's
yeah.
number one, source funding. Yeah, state, I mean, there's lots of groups that you could pull funds from. Grants, you guys write those grants, I know. Cool. And it's was it Dave White?
Dave White.
White, yeah. I've got his email. I was going to email him and catch up on that. Okay, I'll
Mhm.
check with him. Thank you.
Yeah.
So I think we only have 5 minutes left, and I just want to like say I think we made some really good progress today, guys, and I'm really excited about being like in the quarterly meeting and like getting public health folks together. I think that'll really help and get us kind of all the physical activity folks from the health departments all on the same page. We last time, I do want to just like kind of get to the next point on the agenda if we can in 5 minutes. Last time, we have this idea of like getting health department folks active, and we have funding if we want to like ask for some folks to come in and do some programming. I think that we left that like we were going to check our respective health departments to see if we wanted to do something like that. Is that right? Yes. So I didn't know if there's any update. If anybody wants money to like bring in a yoga instructor or a kickboxing instructor.
Yes. Yes.
Yeah.
Yeah.
So
Yep, let's do it. We have a
We
wellness day, so can we just, make that happen?
So Katie, you think the core group would be comfortable just like giving us some money and then distributing it and not knowing exactly where it's going to go?
that's what I was going to say, is that we have to write an application.
It's easy. It's not a real
Yeah.
application, Leah. It's
It's
like
not a real
we're
application.
just essentially
Um,
telling folks what we are going to do and making sure that it fits within the Kansas City Physical Activity Plan.
I think we're working on, is it the same one to like get funding for anything that we talked about last time?
Yeah.
Yes.
Working on that for some community things. I think I had to jump off before we talked about doing something with the health department specifically. So yeah, we can write that up.
Yeah, I mean, we've got all of our funding, and there's other sector groups we can partner with too, like the business and industry sector is starting up right now, and so they have their entire 15,000. We work collaboratively. That's up to 30 grand we could ask for something. So just think big, or think small.
And I will just say, oftentimes, guys, I've like worked on a ton of different like grant funded projects, and if you spend the money, there's often more money, right? So we want to do something and just get get stuff started. I think it's cool to like have funds to like pay Nikki Fit to go deliver kickboxing at any health department whenever they want it, and if we don't spend it, we don't spend it, whatever, but at least it's allocated where we can spend it.
Yeah, and I'm thinking like another thing, you really got to think out of the box. And I think these are great ideas, and that's what you really have to do, because things are really evolving quickly in kind of how we're delivering things in value with the outcome space. Nutrition through all these community gardens that are kind of directed by city and public entities for nutrition. They're getting people to realize good food, get out of the processed food aisle. And I'm in Brookside, and we have a wonderful community market. You know, these open air markets. Every community has one. Lee Summit, Overland Park, the farmers markets is what I'm referring to. You know, events like that, they have people come in from businesses and do yoga, and they're doing that now. So I don't think people are really aware. You know, these things are on a roll. People are starting to realize it's about those relationships we're talking about, just finding them and building even what's there, what's structured there. Somebody comes up from the plaza, from the Pilates place, and does a event at the farmers market where, you know, it's fresh, locally grown. They do take SNAP cards, or what do you call it? SNAP, the state.
The EBT cards, yeah.
Yeah, they take that credit card. So, you know, there's relationships like that could be worked with in these events that you're talking about.
Well, they should also do double up food bucks, but that's a different conversation, not physical activity. So okay, guys, it's 1 o'clock on my calendar, my clock. I just want to thank you for everything. Katie, I think, has a couple last minute things.
Yeah, if we have I'll try and make this in a minute. Just a few announcements. We do have a quarterly meeting coming up in March. It is March 14th. Dr. Amanda Grimes will be presenting the results of a recent project conducted by citizen scientists on neighborhood walking environments near bus stops. So I will go ahead and post that registration. There is a virtual option, but if you would like to come in person, we will be serving breakfast. And then just our next meeting registration. So the next public health sector meeting is March 21st. It is at noon, and I will go ahead and post the link for registering for that meeting in the chat. And that's all I had.
Thank you, Katie. Thank you, everyone. I think we're making some good progress. We'll keep we'll keep moving this stuff forward. And I'm glad we have some good, solid things that we can make happen in the near future. And thank you all for all of your time and energy. I know it's one more meeting, so thank you. Have a good day.